Every day, about 800,000 people in the United States suffer a heart attack. About 20% of them die before reaching the hospital. Heart attacks, a silent killer, not only take lives, but also have a lasting impact on families and society. A heart attack occurs when blood flow to the heart is interrupted. Typically, a layer of fat or cholesterol builds up in the arteries, creating a block. If this block ruptures, blood clots form, and the heart muscle is damaged by the lack of oxygen. When someone is having a heart attack, every minute counts. We say, "Time is muscle." The longer it takes, the more heart tissue will die. Some common but dangerous habits are increasing the risk of heart attack in America. Excessive fast food and processed foods, smoking, lack of physical activity, excessive stress, and obesity. Warning signs of a heart attack. Chest pain or discomfort is the most common symptom of a heart attack. The pain or discomfort can be described as pressure, fullness, tightness, or aching in the center or left side of the chest. Most patients compare it to an elephant sitting on their chest. Important is the fact that this type of discomfort can last for more than a few minutes, or disappear and then reappear. Another serious heart attack symptom is shortness of breath. It can be a symptom on its own, or can be accompanied by a feeling of tightness in the chest, and even an inability to get air or breathe. Someone with this feeling should pay special attention to it if it occurs out of nowhere, with or without other symptoms. Nausea and dizziness can also be early symptoms of a heart attack. Other patients experience nausea along with abdominal pain. Finally, someone may feel that bad things are going to happen, or they may become overextended and then start having symptoms, a condition more common in women, as they do not develop the classic chest discomfort that most patients experience with a heart attack. Unexplained fatigue. While fatigue or exhaustion can occur due to daily activities, it can be one of the warning signs of a heart attack. An unusual level of stress or fatigue that does not go away with rest, especially in women, can be an early sign of a heart attack. These symptoms can start a week before the actual heart attack. If you notice unexplained fatigue that lasts for a whole week, report it to your doctor or go for a medical checkup immediately. Sweating. Unexpected sweating is also a prominent heart attack symptom that should not be ignored. Also known as cold sweats, it can occur for no apparent reason and can create a clammy feeling on the skin. Cold sweats can cause anxiety in the body, and when they occur along with other symptoms of a heart attack, they are a warning sign to seek medical attention. If you experience an unusual cold sweat accompanied by chest pain, seek medical help as soon as possible. Irregular heartbeat. An irregular heartbeat can also be a sign of an early heart attack. Palpitations, or the feeling that your heart is beating, pounding, or irregularly, are also signs of a heart attack. You may feel like your heart is racing, or that it is missing a beat. Irregular heartbeats are mild in healthy patients. However, if they occur in the presence of other symptoms of a heart attack, they should not be ignored. The context of the palpitations should be considered when determining the severity of the situation. Pain in the arms, neck, back, or jaw. Pain radiating from the heart to the arms, neck, back, or jaw can also be referred to as a warning sign of a heart attack. It is often overlooked as a serious early heart attack symptom. The discomfort or pain is not severe, a dull ache or a sharp pain. It is often irregular. In any case, if someone experiences the above symptoms and then other symptoms develop in combination, dial the local emergency number immediately for help. Swelling in the feet, ankles, or legs can be a sign of heart problems and a warning sign of a heart attack. In most cases, it is caused by fluid retention because the heart cannot pump fluid through the body effectively. Any patient who experiences sudden, unexplained swelling should be evaluated by a doctor, especially if it occurs along with other signs and symptoms. Anxiety. It is not uncommon for a heart attack to be accompanied by symptoms of anxiety or panic. Some patients claim that they felt irritable or even had a sense of impending doom before their heart attack. Such psychological symptoms can be quite predictive and should never be ignored when combined with other symptoms. Skin color change. One of the symptoms of a heart attack is a change in the color of the skin around the lips or fingers. This condition is known as cyanosis, caused by a lack of oxygen in the bloodstream. Knowing about these changes can be helpful in understanding the seriousness of the situation. 5 important lifestyle changes to prevent heart attack. Adopt a heart-healthy diet. One of the most important changes you can make to prevent a heart attack is to follow a heart-healthy diet. What you eat has a direct impact on your heart health, as certain foods can either improve or harm it. A diet rich in fruits, vegetables, whole grains, and lean protein is essential for maintaining a healthy heart. Eat fruits and vegetables. They are rich in fiber, vitamins, and minerals that are beneficial for heart health. They also help lower blood pressure and cholesterol levels, which are 2 major risk factors for heart disease. Choose whole grains instead of refined carbohydrates. Whole grains like brown rice, oats, and wheat are great for heart health. They help control blood sugar levels and lower cholesterol. Include lean protein. Fish, especially fatty fish like salmon and mackerel, are great sources of omega-3 fatty acids, which help reduce inflammation and lower your risk of heart disease. Plant-based proteins like beans, lentils, and tofu are also excellent choices. Limit saturated fats and trans fats. These fats can raise cholesterol levels and increase your risk of heart disease. Avoid processed foods, fried foods, and red meat, as they are high in unhealthy fats. By eating a diet that prioritizes these healthy choices, you can significantly reduce your risk of heart attack. Exercise regularly. Regular physical activity is one of the best ways to strengthen your heart and prevent a sudden heart attack. Exercise helps control weight, lower blood pressure, and improve the function of your heart. It improves blood circulation and encourages the growth of new blood vessels, which can be life-saving in the event of a heart attack. Aim for at least 150 minutes a week. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic exercise, such as brisk walking, swimming, or cycling. Include strength training. Building muscle not only strengthens your body, but also helps control blood sugar and cholesterol levels. Try to include strength training at least twice a week. Find activities you enjoy. The key to maintaining an exercise routine is to find activities you enjoy, whether it's hiking, dancing, or playing sports. This will make it easier to stick to your routine in the long run. Even small amounts of regular exercise can reduce your risk of heart disease and prevent sudden heart attacks. Quit smoking and limit alcohol consumption. Smoking is one of the leading causes of heart attacks, as it damages the lining of your arteries, causing plaque to build up and increasing the risk of blood clots. Quitting smoking can dramatically reduce your risk of heart attack, no matter how long you've been smoking. Quit smoking. It's never too late to quit smoking. Within just a few months of quitting, your heart function improves and your risk of heart disease begins to decrease. Avoid secondhand smoke. Even if you don't smoke, exposure to secondhand smoke can increase your risk of heart disease. Try to avoid environments where smoking is common. Manage stress effectively. Chronic stress is another major risk factor for heart attack. When you are stressed, your body releases hormones like cortisol and adrenaline, which can raise blood pressure, increase cholesterol levels, and force your heart to work harder than it needs to. Managing stress is crucial for maintaining a healthy heart. Practice relaxation techniques. Activities like meditation, deep breathing exercises, and yoga can help calm your mind and reduce stress levels. Stay physically active. Regular exercise is a great way to manage stress. Physical activity releases the body's natural stress-relieving chemicals, endorphins, which can help improve your mood and reduce anxiety. Prioritize sleep. Lack of sleep can increase stress and affect your heart. Aim for 7 to 8 hours of good sleep each night to help your body recover and manage stress more effectively. Maintain a support system. Having a strong support network of friends and family can help you cope with stress. Don't hesitate to ask for help or talk to someone when you feel overwhelmed. Effective stress management can greatly reduce the chances of a sudden heart attack. Maintain a healthy weight. Excess weight puts extra strain on your heart and increases your risk of developing conditions like high blood pressure, high cholesterol, and diabetes, all of which are major risk factors for heart attack. Maintaining a healthy weight is one of the best ways to prevent heart disease. Focus on sustainable weight loss. Instead of crash dieting, aim for slow, sustainable weight loss through healthy food choices and regular exercise. Monitor your BMI. Keep an eye on your body mass index to make sure it stays within a healthy range. A BMI between 18.5 and 24.9 is considered healthy. Set realistic goals. Setting small, achievable goals can help you stay motivated and avoid frustration. Focus on losing 1 to 2 pounds per week, which is a healthy rate of weight loss. Maintaining a healthy weight is essential to keeping your heart healthy and reducing your risk of sudden heart attack. Preventing a sudden heart attack requires consistent effort and lifestyle changes. By eating a heart-healthy diet, exercising regularly, quitting smoking, managing stress, and maintaining a healthy weight, you can significantly reduce your risk and enjoy a healthier, longer life. It's never too late to start making these changes, and the benefits will be felt not only on your heart, but also on your overall well-being.